Good evening, everyone. I am Dr. Amit from Bilaspur, Chhattisgarh, and I am reporting for IRACON-TV. I welcome you all on behalf of IRACON 2023. We have with us Dr. Lalit Duggal, who is a senior rheumatologist at Sir Gangaram Hospital, New Delhi. I welcome you, sir. Sir, you have been to so many IRACON. So how did you find this IRACON different from the others? Or can you comment upon the scientific program and the arrangements this year?
Well, the scientific program was very well done in the sense that it was a very good combination of basic science with the actual practice medicine, I would say, because like other IRACONs, there's not so much of deep, kind of basic science in it. A lot of practically oriented subjects, and that is important because a lot of the delegates, maybe more than 80 to 90%, are practicing rheumatologists, and they would need some carry-home messages rather than going into deep basic sciences. That was one very good, I think, take-home message from this IRACON. The other thing was a very well organized, I would say, a very compactly done IRACON in the sense that the halls were very close to each other. You could move from one to the other very easily, whereas in others, perhaps we thought that there were so many different halls going from one to the other was a problem. So this thing was well done, and the whole thing was in a very compact kind of a space. So it made things easier for the delegates.
Right. So, if I may ask, what has inspired you to be a rheumatologist?
The inspiration started from my seniors, actually. When I became a consultant, I was told that you have to do immunology and rheumatology. At that time, we didn't have these postgrad courses, so I was, in fact, pushed into it by my seniors, and that started my story. And after that, when I got into it, when I got into the line, then I found it so fascinating that to be a rheumatologist, you got to be a good internist. And you have to know everything from head to toe. It's just not looking at a line like you got tunnel vision these days. A rheumatologist has to be a complete physician.
Right.
And I was always interested in doing things other than just looking at cold and coughs and internal medicine.
So you are doing so many work in the field of IgG4 related disease. Your talk was there today morning, and I suppose you have the highest number of patients in India of IgG4 related disease. So can we have a 2 to 3 take home message from your talk? What you have delivered today?
I think the basic thing is that there is still very poor awareness as far as the disease is concerned. I'm sure there are many more patients that we are actually seeing. There has to be a great deal of more awareness, and we are seeing that in institutions, but I'm not sure whether it's actually existing in general practice. So you got to identify disease, you got to identify, patients who probably would fit into this disease, and for that you need more awareness, maybe informing the general physicians about the actual existence of the disease. I'm not at all happy with the kind of incident that's being reported. I'm sure it's much more. Secondly, the other way around, if you go to the institution, they're being trying to over-diagnose, doing random testing of the IgG4 levels, which are leading to unnecessary add-on investigations, where the disease doesn't actually exist. So this is the second point where you kind of looking at a disease which is not there. And the third part is rationalizing the whole setup as far as the investigations are concerned and the management of the disease is concerned, which is quite hodgepodge right now. There are no clear-cut guidelines, so we need to formulate that from an Indian context.
So the rheumatology is growing in a very fast pace, and there are so many research going on in our field. So what, according to you, is the new update or innovation that has changed rheumatology in last decade?
In our country?
In our country.
Well, I would say that the changing game has actually been therapeutics, and that perhaps the cheaper biosimilars and the coming of small molecules, that is tofacitinib, as far as the management is concerned. The flip side of it is that we're using these drugs everywhere, especially the non-rheumatologists are using it for conditions such as back aches and non-specific aches and pains. So I would perhaps feel that the game changer as far as the management is concerned are these two aspects.
That's great, sir. Thank you for sharing your knowledge with us and giving us your time. This was Dr. Lalit Duggal, and thank you, sir, for thank you for coming with us. Thank you, sir.